You're watching a special edition of Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. On this show, we take a very special look at TMJ, or TMD, the dysfunction of the jaw joint, and sleeping disorders, including sleep apnea, that adversely affect the quality of life for millions of people, with one of the leading providers of cutting-edge treatment available. So if you have headaches, neck or shoulder pain, jaw pain, snore, toss and turn at night, are fatigued, or maybe know someone who is, then stick around. You're about to hear some life-changing information. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're very pleased to have in studio Dr. Roy Jolly. Dr. Jolly is a fellow of the American Academy of Craniofacial Pain, a small and select group of dental professionals specializing in the treatment of TMJ and sleep disorders, and is considered by most to be one of the premier comprehensive care providers available today. Dr. Jolly's general dentistry practice in Little Rock is recognized by patients and peers alike as a cutting-edge treatment and care facility for the cure of TMJ and sleep disorder problems. Dr. Jolly, welcome to the show.
Thank you, Mike. It's a privilege to be here. Thank you for having me on the show.
Okay, I came out now. I did a little background, as I do with everybody. I came out to your practice before having you on, and I can't help but notice that your practice is more of a spa-like setting. It's almost like being in a tree house. Well, we're going to go through some pictures, but tell me a little bit about the development of your practice.
Well, Mike, the number one reason people don't come to a dental office is fear. So we've tried to create in our office a fearless type of environment, and as you said, a spa type environment. That's exactly what we've tried to create. Now, you'll see this is a picture of my office. It's in the woods, sits back in a natural setting. There's an inside, this is our reception area. It's clean, crisp. When you walk in, it doesn't smell like a dental office. It smells of aromatherapy. Smells like more of a massage spa than it does a dental office.
Well, your waiting room had the plants. I mean, again, the big windows that were open. This is just down a hallway.
Shot down the hall.
Again, much more of spa-like feeling. I took this picture. This is what I call behind the office. When you go into the back office, normally you see the charts and the clutter and it's very clean. But if we look in that operatory, you kind of see a little bit of foliage through the window there. And I took this next picture because every operatory you have has a window just like this. The whole wall's glass looking out into beautiful greenery. And I mean all of them. Normal dentist office, you have the wall and you have, normally some Venetian blinds with a little dust on them.
Well, this is no accident. Our office was designed to create a warm environment, again, addressing the fear issue, trying to create a really unique experience when you come to my dental office.
Okay, now, speaking of unique, who is this cast of characters?
This is my staff, who I might say is the best staff in the world. I could not practice the type of dentistry I practice without this professional staff. Every one of them are just top-notch, excellent clinicians.
Okay, let's get into what is TMJ or TMD, how do you treat it, and how does your treatment differ? First of all, give me a little explanation using the photos about what is it actually.
Well, the TMJ joint is the jaw joint. If this is the mandible, these are the condyles. You with me? This is the condyles. And here's a picture of a condyle with a disc on top, the blue disc. That's a normal relationship. Behind the disc, you see these normal tight ligaments that control the disc as the jaw opens and closes, as the red muscle pulls the jaw forward and the disc forward, the ligaments pull the disc back. Now, if you'll go to the next slide, you'll see here's an example of a patient who is either grinding their teeth, a whiplash injury, possible bicuspid extraction, where the condyle now is up and back. So the disc is pushed forward. Notice that the disc is now red, indicating inflammation. Those normal ligaments are now stretched. Go back to the first picture, Mike.
Okay.
Now, if you'll notice the normal tight look at the difference in these ligaments, and go to the second slide. And see how these are stretched? Now when the jaw opens, it pops onto the disc, and then when it closes, it pops off the disc and presses on these ligaments, which also is the same area where there's nerves and blood vessels.
And then over time, does that just continue to get worse?
Yes. If you don't hear anything else I say, in fact, we're about to see a movie about this. Temporomandibular disease is always progressive. If you have a clicking joint, that joint in time, given enough time, will break down. So if you can...
Let's go to look at the thing. I want to talk to you, though. You made a comment to me about TMD or TMJ being the great imposter.
The great imposter.
Meaning most people would think you would feel the pain here in your jaw joint, but the pain's felt throughout the body.
The most common symptom of temporomandibular disease is headache. Now you would think if I have a jaw joint problem, the primary point of pain would be in the joint, but that's not true in the TMJ. Headache is the #1 symptom. Chronic neck pain, shoulder pain is the second most common symptom. The third most common symptom is popping, clicking, or pain in the joint. And then you get into ringing in the ears, a stuffiness, into loss of hearing, a dizziness, kind of a vertigo
All
feeling.
from the jaw joint.
All because the condyle is sitting right in front of the ear canal, so you have ear symptoms. But it's important to know that are we looking at this picture?
Yes, we can look at this.
Behind this yellow area that you see looks like a fat pad, but what actually is there are nerves and blood vessels, some of the major arteries and veins of the body. The jugular vein, the carotid artery, the trigeminal nerve, the auriculotemporal
all run
nerve,
through there.
all run right through this.
Okay.
So when this condyle backs up, it presses on those nerves, and that produces the symptoms throughout the body. For example, if you hurt your neck and your fingers get numb,
Oh, no.
a good example, you pinch the nerve here, but the pain is in the fingers.
All
Same
right.
thing in the TMJ joint. If you press these nerves, you can have symptoms almost anywhere in the body.
And this is
that's
a normal...
the reason it's called the great imposter.
So you can feel it anywhere. But
That's exactly right.
And this is a normal, we're going to get into that because I interviewed a lot of your patients, and most of them had seen a multitude of other doctors before getting to you. So this is what a properly set joint would look
Right.
like.
The orange is the disc. The
Okay.
yellow are the nerves and the blood vessels. This first line is the condyle, and the second line is the fossa.
Okay.
Now, if you show normal opening, as the condyle slides forward, it rides on the orange disc. That's
Right.
perfectly normal. And then you start grinding your teeth,
Okay.
or have some trauma. The disc moves forward, still within normal limits. And then this gets a little bit worse. The disc continues to move forward. Now you notice we've created a pop. There's a pop in the joint as you
Right.
open and a pop when you close. And if you continue, it gets a little bit worse. Can you make that go forward?
Yeah, let's go right here. Oops, I'm a little farther. Sorry about that, Doc.
Well, you're
All right, go
all
ahead.
the way forward now. Now when the patient tries to open, they have a restricted opening. And many patients out there watching this will say, you know, my mouth doesn't open fully anymore. And they're in stage 3 of temporomandibular disease.
What happens after stage 3?
Well, what we don't want to happen is for this condyle to perforate the disc, and now we're bone on bone, which is osteoarthritis.
And in most cases, you said the bone has a tendency to rest on the backbone, compressing all those veins and nerves, which is why we feel it throughout our body. All right, when I came to your office, and again, we're running out of time, we have to take a break, but I have an interview I want to look at because I asked you about age of the patients. And you had a patient there, I think she's 86 or 87. Let's take a look at her interview.
Our dentist at home pulled a wisdom tooth, and here I am, 86 years old, a year ago last October, and it started popping. My bones popped on my right side. He decided finally, I had headaches, earaches, backaches, and he finally decided to put another tooth back in that hole. And he left the tooth that was next to it and pulled the one on the other side to put a permanent bridge in. And when that all got in, my popping got worse, my headaches got worse, my neck hurt, had the earache. It was just bad. A friend of my daughter